Hey guys, and welcome back to another video from the Modern Vet, aka Dr. Armstrong. I just want to start off by saying, number one, thank you so much for all of my 500 subscribers. Considering that I haven't even been that active as much as I'd like to be, I really appreciate the fact that at least 500 people have hit the subscribe button because they found my videos useful and helpful. And for those of you who do watch who have yet to subscribe, still thank you, because that must mean something, that I'm helping you, right? Like you're still watching. So I really appreciate you all. So a few obvious reasons why medical math is so important. First of all, we need to know how to compute, period. All right, that's just a part of life. But as a doctor, you need to know your stuff. Everybody is looking at you. So when they say, hey doc, how much of this medicine should I give this patient? And you're like, I don't even know where to begin. Oh, shoot.
Give me 1 second.
All right, so let's begin. Few things we're going to talk about first, and that is dosage. We're going to talk about concentration, right? All these terms that we kind of maybe take for granted because it's like, all right, I kind of know what you're talking about, but we really need to know what these terms actually mean, because whenever you're having discourse amongst your team, your nurses, your technicians, whatever other doctors, you need to be crystal clear what you are prescribing, what you are dictating, because your patient's life depends on it. So what is dose? What exactly does dose mean? Dose means the amount of drug that you are giving a patient at a specific time, all right? So most commonly, it's going to be in milligrams, it's going to be in milliliters, it's going to be in micrograms even, right? But it's the dose, the amounts that you're giving a patient at a particular time. Whenever you're calculating the dose, which we'll get into a little bit later, right? That's mg per kg most commonly. But ultimately, the dose is the amount of drug that you're giving a patient at a specific time. So for example, if I'm going to give a patient 500 milligrams of metronidazole, tablets of 500 milligrams of metronidazole, that's the dose. Like that's how much he's getting orally, okay? That's the amount. Dosage is the amount of medication given, the frequency with which you give that medication, and the duration of time that the medication is going to be given. For example, the dosage of metronidazole, 500 milligrams, is going to be every 12 hours for 5 days. That's the dosage. So the dose is 500 milligrams, the dosage is 500 milligrams every 12 hours for 5 days. That is the difference between dose and dosage. Concentration of a drug. We really primarily worry about concentration of a drug whenever we're dealing with liquids, solutions, injectables, things like that. So let's just say I have a patient, I want them to have metronidazole, but they can't take pills for whatever reason. Let's just say they're the worst patient ever and they're so difficult to pill. So my other option is, well, I'm going to give it oral suspension of metronidazole. Now I need to know what my concentration of the drug is in order for me to calculate my dose, my total amount. So I'm going to get into that a little bit later, but essentially concentration is how much solute in the solution, right? So 5 milligrams per milliliter, that is the concentration of a drug. 100 milligrams per milliliter, that is the concentration of a drug. 15 milligrams per 5 milliliters, that is the concentration of a drug, okay? Liquid, suspension, injectable, very important. You need to make sure you are watching your units. For example, whenever we are weighing our patients, commonly in veterinary medicine, we weigh in kilograms, commonly. If you're gonna weigh in pounds, cool. Just make sure that whatever you are doing, whatever kind of medication you're trying to calculate, if it's saying, hey, we dose in mgs per kg or milligrams per kilogram, make sure that you are converting your pounds to kilograms before you calculate anything. Very important. So if I have a dog that's say 70 pounds and I need to convert that to kilograms because I want to work in kilograms for the sake of my drug calculations, I am going to divide 70 pounds by 2.2, and that is going to give me my weight in kilograms. So to convert from pounds to kilograms, I divide my weight in pounds by 2.2. Magic number, just remember it, make it like burn in your frontal lobe, okay? 2.2. The other thing is, whenever you're calculating medication, again, always make sure that you are watching your units. So if something is saying, we dose metronidazole in milligrams per kilograms, you're not going to switch to micrograms. You are going to keep it in milligrams. So another medication like fentanyl, which can be dosed in micrograms, make sure you are keeping it consistent with micrograms. Last but not least, when we are talking about drug calculations, and whenever you're writing your prescriptions, always let your team know. And whenever you're writing your prescriptions, whenever you're writing your treatment plans, always let your team know the route of administration. Don't take those things for granted. Very important. You're being complete, you're being thorough, okay? So you're either going to give it by mouth or orally, PO. You're probably going to give it IV or intravenous. You're probably going to give it IM or intramuscular. You're probably going to give it sub-Q or subcutaneously, right? Then you also have to let them know, again, the frequency. So either you're going to give it SID once a day, every 24 hours, Q 24 hours, or you're going to give it BID twice a day, every 12 hours, Q 12 hours, Q meaning every. Or you're going to give it TID 3 times a day, every 8 hours, Q 8 hours, etc. So now that we've covered all the basics, let's jump into some calculations. Let's just say I have a patient who I want to prescribe Clavamox to, Clavamox tablets. My patient is 10 pounds and the dose for Clavamox is about 13.75 mg per kg. I'm going to use 13.75 mg per kg or milligrams per kilogram and figure out how much of this medication I need to give this patient. So the dog is 10 pounds. I'm not going to do any calculations with pounds because milligrams per kilogram. So that means that I'm going to have to change my pounds to kilograms. And remember, anytime you want to change from pounds to kilograms, you have to divide by 2.2. So whenever I divide 10 by 2.2, I have about 4.5 kilograms, all right? So my patient weighs 4.5 kilograms. Now that I know my weight in kilograms, I can go ahead and figure out how many milligrams of this medication I am to give my patient based on their weight in kilograms. So I'm going to multiply 4.5 kilograms by 13.75 milligrams per kilograms. I do my little cancellations, and now I'm left with for Clavamox. Clavamox is a drug that is dosed every 12 hours or twice a day or BID. So I calculated my dose of 62.5 milligrams and I'm going to give that every 12 hours. So 62.5 milligrams in the morning, 62.5 milligrams in the evening. PO by mouth orally. Let's just say, hypothetically speaking, I want this dog to be on this medication for 7 days. So how many tablets am I going to need to put up all together? Well, knowing that I give 1 tablet in the morning, 1 tablet at night or in the evening, so that's going to be 2 tablets in 1 day. Then I'm giving it over a course of 7 days. 2 times 7 equals 14. So that means that I need to put up a total of 14 tablets for my patient. So now we're going to work with the same patient. He's 10 pounds or 4.5 kgs. Let's just say in addition to the Clavamox, for whatever reason, I want to prescribe him Panicure suspension or fenbendazole. That is suspension, oral suspension, it's liquid. So you're probably like, well, I don't even know how to begin. How do I dose out liquid medications? So first things first, you make sure that you have your weight in kilograms. Then you figure out the dose, how you're going to dose out this medication. So commonly for Panicure, It is dosed at 50 milligrams per kilogram, right? So knowing that I have the weight of my patient in kilograms, knowing that it's 50 milligrams per kilogram for this particular drug, I'm going to multiply 50 by 4.5, and that gives me 225 milligrams. All right, so 225 milligrams, sure, but that's like of a solid, right? Like a tablet. But this is an actual oral suspension. This is liquid. So how on earth do I figure out how many milliliters I need of this suspension? And I know that I have to give my patient 225 milligrams worth. What do I do next? This is where knowing the concentration of the drug comes in handy. So the concentration of liquid medications will always be on that bottle. All right, so you got to find it. So for Panicure, the one that I'm going to use is formulated in a concentration of 100 milligrams per milliliter. So that means that in 1 milliliter of the solution, it contains 100 milligrams of the actual medication, okay? So now you're like, all right, well, what does that even mean? We're starting with our 225 milligrams of fenbendazole. We have our suspension concentration at 100 milligrams per milliliter. To figure out how many milliliters that equates to, you're going to divide the milligrams, the 225 milligrams, by the concentration of 100 milligrams per milliliter, and that's how you get your milliliters. 225 milligrams of this concentration of the solution equals 2.25 milliliters of fenbendazole solution. So that means that at a time, my dose is going to be 2.25 milliliters. So when I give my patient 2.25 milliliters of this drug, I know that they're getting 225 milligrams of that drug. That's what I wanted. That's what I want them to get. Does that make sense? Let's just say we have a 95-pound dog and it needs some dexamethasone SP that has a concentration of 4 milligrams per mil. You need to dose it out at 0.01 milligrams per kilogram and give it intramuscularly. How do you start? So remember, you're going to take your weight in pounds and divide it by 2.2. So that's 43 kgs or kilograms. Then the dose is 0.01 milligrams per kilogram. So I'm going to take my weight in kilograms, so 43 kilograms, multiplied by 0.01 milligram per kilogram, and my dose in milligrams is 0.43 milligrams. Now the medication of dexamethasone SP at 4 milligrams per mil, that concentration is 4 milligrams per milliliter. So to figure out how many milliliters of this drug I need with my dose of 0.43 milligrams, I'm going to take my 0.43 milligrams and divide it by the concentration of 4 milligrams per milliliter, which leaves me with 0.11 milliliters of medication that should be administered IM or intramuscularly. Anyway, I really hope this video has helped someone. If it's just one person, I would be very happy. All it takes is hearing things in a different way, seeing things in a different way, and repetition, practicing over and over again, and ultimately having confidence in yourself. Not being egotistical, not thinking you can never make a mistake. There's a difference. But confident in knowing that you got this, that you can do this, that you went through all these years of training and you know how to calculate. Even if that means you have to practice a million times, it doesn't matter, but you will get it. You are going to get to a point where you won't need to have a pen and paper writing things down and crossing things out. You'll be able to do it in your head. And yeah, every now and then you might want to double check with a calculator. Nothing wrong with that. You might want to have someone on your team double check you. Nothing wrong with that. Okay, if anything, you're being extra cautious for the sake of your patient. We're not worrying about our ego here, all right? If you have any questions at all about anything that I discussed, please let me know in the comments. And if there's anything else I can help you out with as it pertains to drug calculations, let me know. Bye.